But yeah, let's get started. So like I said, I'm Anusha. I'm one of the Medic Portal tutors, and I'm also a medical student. So I myself, of course, gone through the UCAT, just like how you guys are going to be doing it soon enough. So yeah, and in terms of today's webinar, we're going to be focusing on these two subtopics of the UCAT, and we're looking at how to answer challenging quantitative reasoning and situational judgment questions. So we're going to look at QR to begin with, and in terms of objectives, we're thinking about how we can, numbers can be used within these questions, and how they may ask you these kind of questions, and also how we can apply our understanding of our theory to these questions and how to answer them as quickly as possible. In which case, using some certain tips and tricks can really help you save time, as that's the main struggle in terms of the UCAT. So the QR section has quite a variety of questions. Of course, with any section of UCAT, there is certain types of questions that are bound to come up and will come up. So if you have practiced them and know the theory behind answering these questions and how to go about them, then when you actually see them in the UCAT on the actual test day, then it won't be as difficult because you've already, you already know how to answer it. It's just, different number and maybe a few different topics, but it will essentially be the same kind of question. So we have things like percentages and percentage change, as well as ratio and proportion. So you can see that these are quite basic math skills. So of course, it is quite easy to get rusty, and some people do, gradually forget or become less comfortable or confident with their math skills. So it's really important to brush up on things like, percentages and how to work through ratios. And if you are really confident, then of course you'll be much quicker and and do better in the actual UCAT. So we'll focus on these. But of course, if you take part in our UCAT course, we do cover all mathematical areas that the QR section will cover. So getting warmed up. So these are kind of some questions that it's really great to do in your head. So if you guys could have a go at doing these questions really quickly in your head, or of course you can use a piece of paper to write down your answers, of course. So have a go at working from question 1 to 6, and it shouldn't take you too long. So have a go at that now. Once you guys are ready, then you can put a thumbs up in the chat if you'd like to. And the aim of the game is you don't have to be perfect. It's just having a go at doing it as quickly as you can and seeing how well you do, because that's how it's going to be in the actual exam. So I think that's probably enough time. In the real exam, you might even have less time than that to do these kind of questions. So it's really important to be able to try to do this as quickly as possible. And a lot of time is not about being super accurate, but having a good estimate at what the answer is as well. So these are the answers, and you can check it against your own. Oh, sorry. So yeah, so have a look and see if you got these answers right. Oftentimes in the actual you don't need to be as specific. For example, if you were to get the second question to be somewhat around 30, then that's usually enough to get the right answer. Okay, so let's move on now. So we're going to look at an actual question an example of question that you'd get in the actual UCAT. So this one's on probability. So have a look at this question. You've got a table and see whether you can figure out whether the answer is either A, B, C, D, or E. Once you think you've got your answer, please share your answer in the chat box. Okay, so hopefully some of you guys have had some of the type of chance to have a go at this question. Um, if you think you've got the answer, feel free to type it in the chat box, but if not, then I'll have a go at going through the question. So as you can see here, it's talking about the average weather patterns for the month of April, and it's giving you figures of what kind of across the days, and then probability of it being sunny, raining, and so on. So if we look at this question, in April, there are 5 Mondays. Considering only Mondays, what is the approximate probability of it raining on just the first Monday of the month? So the answer here. So we're looking at this question, we need to work out the probability of it raining only on the first Monday of the month. So we need to know the probability of it raining once and not 4 times because it's the first Monday of the month. So if we look at the probability of it raining on any day, it's 15. If we look at Monday and probability of it raining, so when we think about probability of not raining, it's got to be 100 minus 15 because that will leave us with not raining, which is 85%. So we just want to figure out what is the probability of it not raining. So raining is 15, so not raining is 85. So if we want to multiply this, we can multiply it 4 times over 15% times 85%, and then do that 4 times over, which is approximately 7.8%. So what we found out was the probability of it raining once and then not raining 4 times. So this is a simple calculation, but the struggle with this kind of question is that it can often be quite tricky to work through. And obviously, you need to think about how that, in terms of probability, there can be more possible conditions other than rainy, sunny, and rainy. So the probability of it not rainy is not just when it's sunny. It could be that it could be cloudy or, some other possibilities that we don't know about. So you need to be aware of these kind of tricks and be aware of that and not fall into the trap of just getting a probability of sunny instead of not raining, for example. Yeah, and thinking about calculations, it doesn't really matter what order you do it in because we just needed to know the probability of it raining once. So we've got another question here. So this is quite a long one, and oftentimes you can get quite wordy questions in quantitative reasoning, but the key thing is to skim read. So I'll give you like a minute or two to go through this, but you want to be as quick as possible running through the information and try to get to the question and working out as quickly as you can. So have a go at trying to go through that. Okay, so hopefully you guys have had a chance at having a go at this question, but we'll go through this one now. So looking at this one, we're given this very basic diagram of a football pitch, and we know that it's 200 meters by 75, and so on. And then we've got a central circle. So what we're asked to look at is, what's the approximate average speed of both linesmen over the course of the entire match. So this is quite a lot of information to come across, and a key thing is trying to utilize verbal reasoning techniques. So trying to figure out the key aspect of the question, what the question is actually asking us about, and then trying to figure out what's the relevant information of what's being provided. So we've got our answer. So in terms of looking at this, we can see that we've got a football pitch. So if we're thinking about the first lineman running that 200 meters, and then we need to times it by 20. And then we've also got, over the match to have another 200 meters, and we have that by times up by 15 over the match, so 7,000 meters. And if we calculate using that same calculation, the second lineman will cover 6,200. They also run from diagonally opposite corners. So to find the length, we need to think about the actual length of the pitch, which is 200 meters, squaring that. And then we have that 75, which is the other measurement of the pitch, which have 75 squared. And if we put that together, we get 45,625. If we square root that to get the diagonal distance, we get 213.6 meters. So this is covered twice because we have two the linesman, and therefore we get 427.2 because we're just timesing the number by 2. Now, if we add those all together, we get a total of 13,627.2 covered by both of the linesmen. That's because we've got two of them. So in terms of the total, we've got 210 minutes. And if you convert that to hours by dividing it by 60, we get 3.5 hours. Now, what you can do is convert the meters into kilometers. So 13,627.2 meters converted to kilometers is 13.6272 kilometers. And we can divide that by the total time, which we figured out just before, which was 210 minutes or 3.5 hours. So that will mean that we get 3.8 kilometers per hour. That's our average speed. So this is a complex question, and it would be up to you whether you spend a lot of time on it. Some people say that if we know it's a really complex question and that will take a lot of time and we don't have that time, then it's something you want to skip, which is honestly decent advice. It does depend where you're at, though. If you're quite early on in your exam and you actually do have time and you feel that you could work it out, then have a go. But if you're near the end of your exam and you've got lots of more questions and you know this is a very complex one that you don't really know how to work out, then it may be worth skipping and trying and go at other questions which are more simpler. But yeah, it's up to you how you wish to manage your time and how you go about your questions. So you need to think about your calculator and be comfortable with what functions it has. There is a square root button, and you can use it, although the calculator as a whole is something you shouldn't be using too much of because it does really take a lot of time to navigate the calculator and type in your calculations in there. So try to, ideally, if you can, do mental maths and keep, kind of think about conversions in your head. So you can easily convert 90 minutes to an hour and a half, for example, and you don't need to use a calculator for that. So we're just going to move past this question because it's basically similar kind of question. So again, remember, geometry is a really big topic in the UCAT, so it's something that is important to revise and be quite familiar with. Again, it's quite easy to lose track of numbers that you're using when you're doing some calculations, so just make sure to use your paper and write down what you've calculated as well. So in terms of quantitative reasoning, it's definitely not the easiest one. It can be quite tricky with the long kind of questions. But it's not every question that's quite long like this. It's only a few of them. Well, there are a few, but there are as well a lot of questions which are a lot more simpler and straightforward. And with the medic portal's help, it can be really it's a really great way to improve your score, as well as find out more tips and tricks in terms of how to navigate questions and become more confident in taking the QR section for UCAT, as our average quantitative reasoning score is 741, which is a significant difference to the average test taker. In 2022, average people got 658, which is a lot less. So let's just have a look at, oh, sorry, one second. We're looking at situational judgment next. So in terms of situational judgment, we're looking at the different ways in which tests can, test your professionalism in a medical setting. So it's really important to understand the principles behind why something is professional, why something appropriate or important. So if you have an understanding of the principles behind it, that can really help you understand and figure out the answer. So it is that's how you can really understand and then apply your answer, your reasoning to the questions in situational judgment. So first things first, it's although it seems simple and we all know what appropriate means in real life, it's quite important to fully understand what each of the answer options mean. So if you're choosing very appropriate thing to do, we need to make sure that that action is addressing at least one or ideally all the parts of the scenario and is very positive to do in the context. So it's something that's really good and, to be honest, the best thing you can possibly do in this situation. The next answer option is appropriate but not ideal. So this is something that can be done and is actually quite good and will have good consequences. But it probably is not number one thing we do. It's not the best way to risk the scenario. However, if we did it, then it would be still good and have good consequences. It's just not the best. Inappropriate but not awful. So this section is, or answer option is not the best thing we could do. It's not catastrophic, but there's not likely going to be good outcomes from this action, and it's overall negative in the context of the scenario. A very inappropriate thing to do. So this action really is bad. It really should not be done. It would have definitely quite a lot of negative impacts and make things a lot worse. So this is 100% negative, basically. There might be a slight positive aspect to it, but the negative aspect really does outweigh the positive, any positive aspect. So just remember that something that is very appropriate may not be 100%, 100% positive, but it's the best thing we could do. And then something that's very inappropriate may not be 100% negative. There might be something slightly okay about it, but the negative aspect is very great. That's why it pushes it down to the lowest option. So, of course, there is sometimes overlap between the options, and it is up to you to figure out, is it so appropriate that it's the lowest option, or is it inappropriate but not awful, so it is the second least option. So in terms of approaching questions that are appropriateness, the first things first is to read a scenario. So then what you want to do is figure out, is this action in response to the scenario actually a positive or a negative approach? And then sometimes it's a bit of both. Then you can think about, what does that make the answer? So if it's 100% positive, you're probably thinking it's going to be very appropriate. If it's like 80% positive and then 20% not so positive or negative, then it's appropriate but not ideal. And then vice versa, if it's quite negative but there's some positive aspects, then it's inappropriate but not awful. And then if it's really negative, either 100% negative or a very slight positive aspect, then it's very inappropriate. So that can help you decide the answer if you're stuck. try to think what's positive and what's negative about this action, and then that will lead you to the answer. So let's have a go at some questions. If you have a read of the scenario and then rate how appropriate this action is in response to the scenario, so A, B, C, or D. And if you'd like to, please do share your answer in the chat box. Okay, so let's have a look at this question. So in terms of this, you're a junior doctor. So it's really important to first figure out who you are in a scenario because that can impact your answer. So if you're a consultant versus a medical student or a junior doctor, that's something really important to identify. So you enter your ward one morning to overhear a consultant shouting at one of his elderly patients in a side room. His tone is very confrontational. The patient is confused and struggling to understand what the consultant is saying. So this one is wait for a more senior colleague to arrive to mention that you have heard what you have heard to them. So this we need to see, is this appropriate or not? So sorry, 1 second. So this one we have is we're thinking B. So this is appropriate. So I think, not I think, in terms of this scenario, as you're doctor in a position, it is appropriate to talk to a senior person, because that means that they're reporting this behavior or raising awareness about this problem. But this is the thing that's not making this ideal is the fact that they are waiting around a bit and there's a delay involved. So that's not the best because ideally this kind of event should be dealt with immediately or as soon as possible rather than waiting around for the senior. So although this talking to a senior is appropriate, the delay is what's making it not the most ideal circumstance. Okay, how about this action? What do you guys think the answer is? Okay, great. I hope you guys had a chance to think about it. So this time a lot of people are going for the answer A. So knock on the door and find out what's happening and offer your help. So yeah, looking at this question answer, we can see this one is a very appropriate thing to do because, like we said, we're dealing with the issue and we're doing it, we're actually dealing with it straight away instead of waiting around. So this time we're raising alarm, and when someone's patient's dignity or safety is potentially at risk, and especially because this is someone who's quite vulnerable, an elderly patient who is confused. So by doing this, we are stopping this from happening further and doing it, ASAP, which is probably the best thing that we can do. So yeah, like we said, alerting seniors is obviously a good thing. It's going to help us and improve the situation, but it's not ideal because it's happening right now, and it's better to deal with it and actually stop it from happening rather than wait around. Especially if it's about a patient's dignity or safety, those are very important, and it means we need to act immediately. So it's very important that we do something straight away. Um, Sometimes it can be easy to think, compare between different responses, but it's not the best thing to do because um, a common misunderstanding is that only one of the responses can be very appropriate, and then the rest have to be, appropriate but not ideal, or some of the other options. But actually, all the responses can be very appropriate because there can be multiple aspects of a response in terms of a scenario or situation. So it's quite important to treat each response independently. Um, and yeah, so in terms of this situation, the first question was good, and then it may not be the only one that's that answer option. So you don't want to confuse best seen so far with very appropriate, because something that is the best out of all options may not be very appropriate, may still be not ideal. So it's good to think about the different scenario responses they give you, but make sure to treat each one independently from each other. Okay, let's look at this next scenario of this one. So again, rate how appropriate the response is in terms of the scenario. Okay, so I think a lot of people had a go at this one already, which is great. So there's a bit of variety of answers. So looking at this one, you're an F1 doctor. So you're a doctor, but you're quite, you're just new to your job completely. And you're on a busy ward round, and you receive a bleep from pathology lab about a strange blood biochemistry result. You have not seen such a patient before and are unsure how to manage the patient. So how appropriate is this response? So use your smartphone to Google how to manage a patient. So looking at this one, so we can see that this one is C, so it's inappropriate but not awful. So it does appear unprofessional using a smartphone on the ward. Um, but you need to consider how this is an F1 doctor, and it's we're all human, and we're not going to know everything, and we're not going to be always comfortable with dealing with strange biochemistry results. So it's in that case it is important to seek help in some sort of way. So using Google, doctors often do use Google, especially because sometimes there are lots of very good reliable sources that are good to look up. However, it can be obviously websites which are incorrect, not actually reliable, or out of date. So it's not really the best thing to do. So yeah. So although it's not the most inappropriate thing ever, it's just not very professional looking, and um, simply Googling it is not the best way to go about it. It's better to actually look for a senior, or go for reliable information through an actual textbook, for example, the BNF or something like that. Okay, so let's look at this one. So yeah, so let's have a look at this one. Seems like some people have answers already. So prescribe the most obvious medication you think might work. So this one is D. It's not appropriate, very inappropriate, because guessing and just speculating can be very dangerous, and you can imagine that an incorrect dosage or incorrect drug to a patient can be very harmful, and that can be a risk to the patient's safety. So it would be very inappropriate for the F1 to do this, as it can cause a lot of harm. And yeah, if you're really unsure, it's you shouldn't just be guessing around. That it would not be appropriate. So prescribing treatment is very serious and very important. If ever in doubt, always go and ask a senior or actually consult a reliable resource. Um, like we said, the Google It situation is a bit it's a bit of a grey area, because there can be lots of good resources, but so possibly some people would argue it is appropriate but not ideal, because if you Googled it and then consulted the NICE guidelines or something like that, then that would be technically appropriate. Um, but like we said, it's a bit of a grey area. So yeah, in terms of looking at situational judgment, it can seem like a lot, but it's a lot of it is gut instinct and kind of common sense. What is good and what's bad. But if you feel that you're not really sure what's going on, and you don't know the basis of the reasoning behind the answers, then it's really important to gain some understanding through reading things like the GMC's Good Medical Guidance, good medical practice, sorry, because that will allow you to understand what makes a good doctor, what are the important values and things to think about, as well as what a good doctor would be expected to do in certain situations. If you're still stuck, it's also really useful to look at the Medic Portal website. We have lots of resources and guidance on how to go through situational judgment, and we also do tuition, which can give you some one-to-one support. In terms of the Medic Portal method, we always focus on one thing at a time. Today, we looked at how numbers can be used in different, like, quantitative reasoning questions, and we looked at some questions that were testing some of the question types, although we didn't cover all the question types because we wouldn't have enough time to do this in today's webinar. So that is limiting cognitive load, which is actually really helpful in terms of actually understanding how to do the questions. The questions can be vary in difficulty, so so in terms of increasing in difficulty challenge, we're still testing the same skills, so it's deliberative practice. So in terms of leveling up your UCAT prep, it's really important for us to learn about the strategy and the theory behind the UCAT, and a really good way to get a great comprehensive understanding of that is through our live UCAT course, because we go through all these types of question types in, for example, quantitative reasoning, and that can help you really get a great start and full understanding of what can come up. And if you really want to really level up your UCAT prep and get to your best potential, then one-to-one tuition can be a great way to do that. So it's a really good idea in that terms. But the best thing to do is really combine how you learn the UCAT. So combine live UCAT teaching, e-learning, do some test practice, actually apply your learning to questions, and get extra help about tips and tricks and strategies to really level up your maximum UCAT score through tutoring. And you can do that with our UCAT packages. So you can get extra 10% off with the code WELCOME10. And that can be, a really good deal and really help you attain the best, possible score and get into the dream medical school that you want to get into. So we've basically come to the end of the slides. Does anyone have any questions to ask at all? Feel free to ask any questions that you may have about the UCAT. It doesn't have to be about quantitative reasoning. It could be about any of these sections, verbal reasoning, situational judgment, or the UCAT process. But if there's no questions, then thank you so much for joining in today's webinar and listening in. Hope you found it useful. And like I said, get an extra 10% with the code welcome10, and that can be really helpful to get extra, build up your extra confidence, really get the understanding of the UCAT and how to go about the questions, and of course address any weaknesses or worries you have about the UCAT. Yes, so someone asked if you do average or badly in the UCAT, but have a really good personal statement and interview, can you still get into some universities? And I would say yes, of course, you can still get into universities if you don't do so good on UCAT. So lots of people who get maybe average UCAT scores um, can still get into universities. And the key thing is to consider where you apply. So, of course, if you have an average UCAT score, don't apply to a university that really has a strong emphasis on a high UCAT score. There's lots of universities that will accept lower UCAT scores. And because many university, or basically all universities, take quite a holistic approach in terms of which student will take a place in their medical school. So yes, if you have a really good interview or really good GCSE grades and so on, that can be something that be a good factor in allowing you to get into medical school, even if your UCAT was not as hard, as great as you hoped. Yeah, I'm not sure why people can't chat in the main chat for some reason. But if you look on the main chat, we've actually provided you a link to looking at how universities use the UCAT score. So if you want to actually consult that and see, what universities can I look at and how, what universities I'd like to perhaps consider to apply to, then have a look at that link, and that can be really helpful. So hopefully you can see the link now. Someone asked how many hours of revision do you recommend a day? It depends on what stage you're at. If you are really close to your UCAT date, like 2 weeks away, then perhaps try to practice every day. But you don't need to overdo it because it is a skill. So a skill is something you build up over time. You can't, practice all day and then in one day and then expect to be amazing. It's something you build up slowly. And if you do too much practice, you'll just get burnt out and just really tired. So maybe practice, 1 hour, 2 hours a day. But yeah, it also depends on how you are as a person. If you're a person who can really cope with, and manage lots of hours of practice in a day, then of course go ahead and do lots of practice. But I don't think, honestly, I don't think there's much point in doing more than, maximum 2 hours in a day. Are there any specific techniques you recommend in terms of time management? Because time is very limited. Yes, so of course, time is very limited, and that's the main difficulty of the UCAT. So, there, in terms of how to get better timing, is to, it's mainly, it sounds quite, obvious, but it's to do with time management. So be aware of how much time you have, how many questions you're trying to answer and really be on top of it. So if you've allocated yourself 1 minute per question, then try your best to stick to that. Of course, if you finish earlier and take 20 seconds to finish a question, then that's great. You can keep that for the end or use that for a more difficult question. So keep on track of time and make sure to look at the time and try to stick to your timing. But obviously, this takes time to build up. And when you're still getting used to the theory behind UCAT and how to answer questions, it can be really difficult to stick to timing. So, first of all, try to get really used to the theory behind a UCAT and understand how to go through the questions and get good marks and actually get the questions right. And once you've figured out how to do that and you're getting really, getting most of the questions right that you're practicing, then try to implement timing. So that's all the time we have for today. I hope you guys, did well in terms of engaging and enjoy the rest of your day. And thank you so much for coming. Bye for now.